So I'm just going to take a few minutes just to remind you of the key points that we've made during these talks. So persistent pain affects a surprising number of people. The symptoms are often distressing and can be severe, but the cause is rarely anything sinister. It's important to remember though, if you do feel any unusual symptoms or feel unwell or have a new really significant injury, then this does need checking out by an appropriately qualified health professional. It's now well recognised that in persistent pain, the pain system changes itself. And the nerves and the brain have a very important role to play. Changes in this system make the pain worse than it needs otherwise be. And it's also known that loss of fitness and strength, usually associated with persistent pain, means that many people are able to do less of the things they want to do than need necessarily be the case. There's no direct cure for this type of persistent pain at the moment, unfortunately, so you need to focus on the way that you manage that pain. And research shows us clearly that in many cases you can effectively treat the changes of the pain system and the losses of fitness and strength using the tactics that we've described in this talk. In particular, remember that gradually introducing regular and gentle exercise is important. Keeping the stress and anxiety level in your life to a minimum will help. And taking time to relax and do some of the things that you enjoy doing on a regular basis. Remember that it's likely, almost inevitable, that your pain will increase from time to time, but it's unlikely that anything new has been damaged. And keeping as active and being as optimistic as you can if your pain does flare up will help you get over that bad period. Making the changes to your life and the way that you think about your pain that are recommended in this talk will not be easy. But if you make the effort and persist through the inevitable setbacks that are likely to occur, then you'll be able to manage this difficult problem in a positive way that means that rather than the pain controlling you, you will at last have some control over the pain.